Welcome to this first class of statistics. This class will begin a series of audio-enhanced PowerPoints that cover the primary topics of the class. In this lecture, we'll focus on the basic terms we'll be using all semester. The first term we want to consider is variable. A variable is something that can vary or exist in two or more states. Most things in nature are capable of varying and thus are capable of being variables. So gender, for example, varies from men to women. Scores on a test measuring depression can vary, or the income of individuals in the United States clearly vary. Although anything can vary, in research, whether or not we think of something as a variable depends on the context or how it is used in a specific circumstance. So, although sex varies in nature, if we organize a study in which we only study men, then we would say sex is a constant in the context of a study. Thus, a constant is something that does not vary or has only one value. If the context of a specific situation, such as a study or some other circumstance, something that varies in nature can be made into a constant. Here's another example. While age varies, if we want to conduct a study in which the participants are all from the same developmental era, say from ages 16 to 18, we would say age is a constant in the study. In even another example, while anxiety differs between individuals or varies, if we conduct a study in which we only study individuals suffering from generalized anxiety disorder, then anxiety would be a constant in that study. To consider variables a little further, we can think of variables as being continuous or categorical. If a variable is measured by a scale that results in a score or a ranking or a rating, we will regard the variable as a continuous variable. Thus, scores on the Beck Depression Inventory, a common measure of depression we use in our field, will be a continuous variable. If a variable is measured by a scale that results in placing individuals in categories or classifies individuals, we'll call that a categorical variable. Thus, if sex is a variable in a research study, meaning that it is not a constant, then participants will be either men or women. In another example, say we want to measure political affiliation by classifying participants as Republican, Democrat, or Independent. The categories of a categorical variable are called levels, very important term. So men and women would be levels of the variable gender, and Republican, Democrat, and Independent would be levels of the variable political affiliation. In an extremely important use of the term variable and levels, imagine we select a sample of individuals suffering from depression and then assign some of them to a treatment group and the others to a no treatment control group. In this study, we would say we have one variable with two levels. Thus, a control group is not a separate variable, but rather is a level of a variable that includes the other levels against which it is compared. Let's consider next two very important types of variables, independent and dependent variables. An independent variable is said to be under the control of the experimenter. This definition is drawn from a classical experiment in which the researcher controls who will be assigned to levels of a variable. For example, in a true experimental design, a researcher will decide who will be in a treatment in a control group. They'll do this either through random assignment or drawing names from a hat. In many studies in our field, however, the participants assign themselves to levels of a variable, not the researcher. Although the researcher in these circumstances has technically lost control of who is assigned to levels of the variable, of the independent variable, we will still refer to this type of variable as an independent variable. So if we are interested in assessing how well individuals achieve sobriety in different types of substance abuse treatment, say group therapy or residential treatment or in Alcoholics Anonymous, we might study groups of individuals who had already selected these different types of treatment. Although we have, in this example, we've lost control of determining how participants were assigned to levels of the variable, we would still refer to it as the independent variable. And in this example, we would have one independent variable, type of treatment, with 3 levels. Another way to think of the independent variable is that it is the treatment or the experimental condition, or essentially the variable the researcher hypothesizes will cause a change in another variable. Some common synonyms or alternative names for the independent variable are the intervention, or the predictor, or the grouping variable. Let's turn our attention now to the dependent variable. The dependent variable is what we measure or what we hypothesize will be affected or change as a result of participants' exposure to the independent variable. To continue the example we referred to earlier, if we studied a sample of depressed patients, randomly assigned them to treatment or control, and then measured their response to treatment using, say, the Beck Depression Inventory, we would say that we had one independent variable, type of treatment, with 2 levels, treatment or control, and that we had one dependent variable, which are scores on the Beck Depression Inventory. So the dependent variable is what we expect to be affected by the independent variable. This is why common synonyms for the dependent variable is outcome, or one very common synonym for the dependent variable is outcome. The dependent variable is also sometimes called the criterion. Although I provided examples in this and the previous slide of the independent variable as a categorical variable and the dependent variable as a continuous variable, it doesn't have to be that way. In fact, we are interested in correlational studies in which both the independent and dependent variables will be continuous. And later this semester we'll consider situations in which the dependent variables are also can be used as categorical variables. Sometimes it can be pretty tricky to tell the difference between an independent and dependent variable. One way to do that is to try to rephrase the study in the following manner. What is the effect of blank, the independent variable, on the blank, dependent variable? Before going to the next slide, see if you can identify the independent and dependent variable from the title of the following study published in 2006. Learning Sobriety Together, a randomized clinical trial examining behavior couples therapy with alcoholic female patients. One way to rephrase this title might be to say, the effect of behavioral couples therapy, the independent variable, on sobriety, the dependent variable. In this study, participants were actually randomly assigned into either a behavioral couples therapy or an individual therapy or a psychoeducational control group. Thus, there was one independent variable, which was type of treatment, with 3 levels. Sobriety was the dependent variable, and it was measured in a number of ways, but one way it was measured was the number of days someone had been drinking. In this study, women suffering from alcoholism was actually a constant and was not a variable in the study. It was in fact a criteria participants needed to have in order to participate in the study. So in this study, this group was actually the sample of participants. In a few slides later, we will discuss the term sample. To look a little further at independent variables, we can make some additional distinctions. In this slide, we'll discuss the difference between a between subjects independent variable and a within subjects independent variable. In a between subjects independent variable, a participant appears in only one level of the independent variable. So if gender is a variable in a study, you would be in only one level of that variable, either male or female. If you were in the example study of depressed patients randomly assigned to treatment or control, you would only be in the treatment or the control group, or would appear at only one level of the independent variable. That's what makes these between subjects variables. In a within subjects variable, a participant appears in all levels of that variable. Sometimes this type of variable is called repeated measures independent variable, because the participants are measured on the dependent variable at each level of the independent variable, or they're measured repeatedly. The most common example of a within subjects independent variable is when participants in a treatment are measured repeatedly over time. Thus, if you were in the study of depressed individuals randomly assigned to treatment or control, our example study, time would be a within subject independent variable if you were given the Beck Depression Inventory before the beginning of treatment in a pre-test, and then again at the end of treatment, a post-test, and then again 6 months later at a follow-up. So this type of study would have two independent variables, one of which was a between subjects independent variable, type of treatment, with 2 levels, and one was a within subjects independent variable, time, with 3 levels. This design is probably the most important type of design in clinical psychology, as it addresses whether or not treatment is effective and whether or not treatment gains are sustained over time.